So here are some considerations, some best practices that we have seen across the field, and some tips that we've gathered that hopefully can help those listening navigate the challenges we're seeing for elderly patients and those with dementia. So wanting to emphasize really here that, it's social distancing, not isolation, that social networks and support groups and communities are important. They always are, and they don't go away, especially in a time of crisis right now where we need them the most. So really doing what we can to, utilize technology, help, an elderly person better use their phone, set up a video chat call with them, help them kind of navigate social media, maybe set up an account if they haven't ever used it before. But some of the ways that we can really ensure that, this time where we're physically distancing ourselves from each other does not mean that we have to be cut off from the support and the love that is needed to really, support our, mental health and just, our longevity through this response, especially for someone who has a higher risk for illness and a higher risk for, the stress levels and the concerns and the fears that can prevent someone from really recovering at a time like now. Keeping, people involved. I know we all kind of, think about how when you are able to do something, kind of keep yourself moving, keep yourself busy, you will focus less on that isolation that you may feel. And then here at the bottom, we have here just some of the logistics when it comes to actually making sure that their medical care is still being taken care of. So essentially, even more support than ever on scheduling concerns, especially now as we see treatment plans are changing, the way people interact with healthcare facilities are changing. They may be switching to telemedicine and virtual care. And so allowing, helping someone navigate that, helping them navigate those challenges, asking questions and providing resources, walking someone through that process is helpful. And all that, these are great steps, and then all of it comes together when you really make a plan and schedule out what all this looks like and how you're going to support people, what other caretakers may or may not be involved, and how you'll respond, taking care of yourself as a caretaker, and really understanding, as we have the upcoming hurricane season and other disasters that may come across and may overlap with COVID, really understanding the plan for all of these emergencies. And here's some best practices we have here when it comes to reminding patients the hygienic practices that we're using now, the increased levels of hand washing, the covering of the nose, the covering of the mouth, the using tissues, immediately throwing it away, washing hands, almost obsessively. It helps to have maybe a door sign or a sticky note, whatever works in the home that you're working in, showing by example. Essentially, if someone has trouble remembering things and adjusting to a new routine, it won't, help just to say something over and over. It may be incredibly exhausting to repeat something over and over, and that's a challenge that exists. But one thing that may be a little bit helpful and may really help get the message into, the person's mind a little bit better and a little bit easier is just really showing the etiquette, really showing what's happening, being a part of this, because we're all in this together. And so it's really about bringing someone along that journey of adjusting the routine and acknowledging the frustrations that may exist there. Filling prescriptions is really important here. We provide a lot of resources on emergency refills and the ways that patients can access their medications in easier ways during disasters, as you recognize the challenges that exist there. And, upcoming slides that will share the websites we have and the links we have on those resources. And again, here below we have activities, essentially in the time period when we're being very vigilant about disinfecting surfaces using things like laminated paper, if it's a puzzle or a crossword, so you can easily wipe it down and disinfect and keep using. And then here are some considerations for the caretaker yourself. So if you are a caretaker, understanding what happens if you get sick. Because, at a time like now, if you're COVID positive, being extra careful, not just with how that impacts your health, but if you're providing direct care and, closely physically, in contact with a patient, that you're supporting in their home, the risk you run of infecting them and, the extra precautions that you have to take to make sure that doesn't happen. So recognizing that if you get sick, that you're, who is going to provide care in your absence. And same thing with self-quarantine. We touched on earlier how quarantine is essentially protecting yourself and protecting others if you have COVID and if you have an infectious disease, isolating yourself from people so you're not able to spread it. But in a time like this, where everyone doesn't have access to a test, we're still, the healthcare system is still working to provide tests across the board. Sometimes it's easier to default to assuming that you are COVID positive and quarantining and, being extra vigilant about social distancing. And understanding that, again, if you are COVID positive, there's a high risk that you're spreading this to your client or the person you're supporting, your family member, your loved one. And so really being extra cautious about that. And same thing with checking your temperature and your symptoms regularly, and checking in on other caregivers. And here, want to highlight that it's not just about checking your temperatures and, being vigilant about whether or not you're COVID positive, but also being vigilant about the real mental health impacts that may happen at a time like now. So when you are providing care at a heightened level, where you're taking extra steps to support someone dealing with this pandemic, and you yourself are also dealing with this pandemic and maybe dealing with, loss in your family, maybe dealing with grief on your own in the healthcare facility and the, long-term care facility, there's just an extra consideration that has to go into your own health and how well you are able to provide care and the breaks you're giving yourself, and the rest that you're giving yourself. And so that's an important consideration. So checking in on your support team of caregivers, and making sure you have that support team as well is incredibly important. And responding, to signs of burnout, signs of stress, and seeking care and professional help when you need it.